Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to this brief presentation on how to sustain good health, mental and physical, during Hajj. As you know, most of you will be going to various seminars around the different aspects of Hajj and what you need to accomplish throughout the period, but not many people are aware of how to maintain good mental and physical health, which will allow you to enjoy the journey further. So this brief presentation, presented through over a decade of experience during Hajj, will hopefully, inshallah, enlighten you as to how to prepare to get the best out of your pilgrimage. To start with, I'll briefly explain what the British Hajj Delegation is. For over a decade, a group of doctors have been going out to Hajj, providing free healthcare to the British Hujjaj. Originally part of the Labour government, we used to go out with Foreign Office officials and provide a complete healthcare and holistic service to the Hujjaj. When austerity measures started, the funding was stopped and the doctors decided that they would like to continue providing this service to you and therefore set this up as a charity. We now go out on a yearly basis and the doctors fund their own expenses, including accommodation, travel, food, and any expenses incurred by them not being in their own GP surgery. This may be getting locums in to do their clinics whilst they are away in Saudi Arabia performing the pilgrimage and providing you a service. It is a charity that is UK registered, and if you wish to be involved, then by all means look at our website, the address of which will come up soon, and be part of our delegation. Moving on to the presentation. To start with, the journey starts before you go out to Saudi Arabia. For those of you that have existing medical problems, you will be on routine medication. On a monthly basis, when you get your prescription, you will have a prescription that is on green paper, but on the right hand side will be a list of your medication that you take on a regular basis. Now it's important that you take this copy with you, because in Saudi Arabia, although many drugs are available, their names may be slightly different, making it difficult to try and get replacement medication should you run out or should you lose your medication. My advice to you would be to take the hard copy, the piece of paper, take a picture of it on a camera or your phone so you have a copy, but also keep the hard copy, the paper copy, in your suitcase should you accidentally lose the electronic version. The medication in Saudi Arabia is expensive, and if you are on regular medication in this country, then by all means take some more just in case you lose some medication. There is no free medication from the pharmacists in Saudi Arabia, and therefore anything that you run out of, you will need to purchase. Ensure that you have written down somewhere within your belongings a list of your current medical problems, as well as any allergies you may have. As you will be aware, getting your visa for Hajj includes mandatory requirement to have the meningitis ACWY vaccine. Up to now, the Kingdom of Saudi Arabia, for Hajj purposes, recognised the vaccine for a period of 3 years, but has recently changed the rules, and now a vaccine with the appropriate certificate is valid for 5 years for obtaining your Hajj visa. As well as this mandatory vaccine, there are other vaccines that you could obtain from your GP free of charge, and one of those that I would recommend is that if in the past 10 years you've not had your tetanus vaccine, then I would suggest you get a tetanus vaccine. If you contact your surgery, the nurse should be able to look at your medical records and provide you advice on whether you require a booster, and this will help in case you sustain any cuts or injuries during your pilgrimage. On the day of travel, leave home early. The likelihood is that there will be many people at the airport, there will be large crowds, and people will start getting stressed due to the waiting. You need to ensure that you have at least a couple of days worth of medication in your hand luggage, as you may find delays during your journey to Saudi Arabia and getting to your hotel may result in you not having access to your suitcase if you pack all your medication in cargo. For those of you who hold medication in your hand luggage, ensure that you don't require some proof from your GP, such as a written letter for which your GP may charge you a fee, for things like needles, and also certain medications are illegal in Saudi Arabia, and you should ensure that you have got clearance to carry those medication before you take them into the kingdom. Most of these medications are things that can develop dependence, such as morphine, pethidine, tramadol, and doses of codeine. If you have any questions, then contact your tour operator and ask them to look into this to ensure that there is no trouble once you arrive in the kingdom. Make sure you also have the correct luggage allowance. There's nothing worse than getting to the airport being told that your suitcase is overweight and having to open the case and start moving things around or deciding what you can't take. When you arrive in the Kingdom of Saudi Arabia, stay with the group. Your tour operator will guide you on where you need to go to get clearance. Be tolerant. At the airport, there will be Hujjaj from around the world, and people from different countries have different cultural beliefs, and they may not all have the same belief you do, and therefore they may act in a way which you may feel is abnormal, but to them it's normal. Be tolerant, be patient. This is the beginning of Hajj for you. Make sure you have small regular meals and drink plenty of fluids, especially during the months of summer when it will be very hot and dehydration will become a reality. When passing urine, if your urine is dark in colour, you don't have enough fluid on board, drink more fluid. And the important thing is, stay with your group. One Hujjaj that goes missing holds the whole group up and will cause significant problems for your tour operator. When you arrive in Saudi Arabia, you may be given a red bracelet which has your details on. If you can, on the inside of that bracelet, if you have any existing medical problems, put the condition on the back. If you should sustain any health problems, it will make it easier for the doctors to have a look on the inside and find out whether you do have diabetes, breathing problems, heart problems, or anything else, to ensure that they can assess you for those first before looking for any other problems. Once you arrive in Mecca, take some rest. There is nothing that says that you must get off the coach, drop your suitcases in the room, and rush off to the haram to fulfill your tawaf and sa'i. Your body will already have undergone significant trauma from the travel. Have something to eat, have something to drink, have a little nap, and let your body regain its energy before you go and fulfill your tawaf. When performing your tawaf, avoid heavy crowded areas. This is easier to say than done, but you will find that there are parts of the haram which are slightly quieter than other areas. If you decide to perform tawaf in the mataf, the ground floor, you will find that people are shoulder to shoulder. Don't try and rush through. You will injure somebody else if not yourself. Various other countries will bring groups along, and as in this picture, you will find that they have hijab of the same colour, which keeps the group together and helps their tour operator identify their hujjaj. If you find such a group is heading towards you, do not try and stand your ground. Move to one side and let them through. Usually, the sisters in the coloured hijab are surrounded by their brothers, husbands, who are in a ring interlinked with each other. This ring will not break, and if you are in their way, the chances are you will get pushed out of the way and you may sustain an injury. So move out of the way, let them pass through, and then carry on your tawaf. Try and avoid midday sun, because that will lead to dehydration. And although many perceive that the ground flow will be quicker because it is a shorter circumambulation around the Kaaba, you will find that because there are so many people, it will take a lot longer. So you may decide to go on the first or second floor where there is a roof above head. The actual journey is a bit longer, but because there are less people, there's less crowding and less pushing. During the days of Hajj, when you go to the Jamarat, you will find these kind of water taps. Take a small bottle with you, drink regularly to avoid dehydration, and if your water runs out, by all means use these water taps to refill your bottle. Sip water rather than gulp water, and if possible on those days, avoid things like coffee, tea and fizzy drinks, which may make you pass more urine and become dehydrated. You will all know the merits of Zamzam water. It is very, very good for rehydration and for nutrition. It's easily available during the days of Hajj in Mecca and Medina. It's free, and where possible, try and drink the warm room temperature version rather than the cold version, which for some of you will lead to a sore throat. Remember, no matter what medication you are on, even if you are drinking copious amounts of Zamzam water, you still need to take your medication to avoid your illness getting worse and ended up in hospital. In the tents of Mina, drink regularly. You will notice these brown coloured bins within the corner, and your tour operator should ensure that those are filled with drinks and water on a regular basis. Try and drink more water than fizzy drinks. During these days, avoid climbing the hills and mountains around your tent, and be clear on your location, as throughout Mina all the tents look the same and it's very easy to get lost. Find areas around your tent which could act as landmarks. This may be the fire station, a Saudi medical clinic which will have a number allocated to it, or a telephone mast, but ensure you are aware of where your tent is, as once you get lost it could be many hours before you get back to your normal tent. The British Hajj Delegation runs a clinic within Mina. The service is free, and whatever medication we have, you can have for free. We do undertake treatment of blisters and also perform bandaging, but this is one of the commonest conditions that we come across. Blisters and rashes are the two problems that many Hujjaj face during the days of Hajj. Where possible, use Vaseline on your legs, and you look at the manual, which will be referred to at the end of this presentation, which will guide you on some of the products that you can buy at your local pharmacy and take out to Hajj to help us treat you should we run out of our own supply. Everybody is welcome, and the only one day where there is no service available from our delegation is the day of Arafat. So by all means, ask your tour operator where our clinic is should you need our support, and if you can go onto our website, inshallah we will put our location and our contact details on there to make life easier for you. We will also put our Saudi mobile phone number so that should you require our help but are unable to attend our clinic, you can ring our Saudi number and inshallah one of the doctors will pick up the phone and give you telephone advice to guide you on what you should do. During the days of Jamarat, it does get very crowded, and if possible, when you arrive at the Jamarat, avoid running to the front of the pillars to try and get your stoning done straight away. If you take your time and move away from the pillar, have a look at the far end of the pillar. Very often it's quiet and you can get right up to the actual boundary to be able to do your stoning without any injury or crowding. Once the days of Jamarat are finished and you are ready to come out of your ihram, try and avoid rushing into having your head shaved. You'll see people around the Jamarat and back in Mina having their head shaved in the streets or in the corridors around the tents. Hygiene and risk of infection is a reality. Use the professional barbers that are available, that are commissioned by the Saudi authority. The cost of having your hair done is very minimal, but you can ensure that you're in a safe environment with minimal risk of any infection. So take your time, find a safe place, and be guided by your tour operator on where to have your hair shaved. The Ministry of Hajj will put posters around Kaaba and around the various towns and cities related to Hajj. Take a couple of minutes and have a quick read of the diagrams. They're self-explanatory, but they're very useful to guide you on how to maintain good physical health. Hygiene is important. With over 3 million people performing Hajj from around the world, people will have infections, people will have caught viruses, and you may sustain an infection yourself. Try and ensure cleanliness. If you can get hold of alcohol-free gel, which you can take from this country, ensure that it's not scented to make sure that you don't fall foul of your obligations of performing Hajj. But use tissue, dispose of the tissues in the bins, don't throw them on the floor, and make sure that after you've sneezed or coughed, you use your gel to clean your hands to avoid transmission of infection to other people. If you have picked up a virus or a cough, try and avoid crowded places so that you don't pass and sneeze, cough on other Hujjaj, passing the virus on to them. There are various common ailments that you will see, you may even suffer with, and these are some of the things that we see on a regular basis. Have a look at the manual that's referred to at the end of this presentation. It's free to download, and in there's some guidance on how you can minimise the risk of you developing a blister. Many of you may get ankle swelling because of the distance you're walking and also the heat, and the best way to treat this is to sit down when you're resting and keep your legs elevated by putting a couple of pillows or something like a bag underneath so that some of the swelling can go down. Many of you will sustain or develop a Hajji cough. This is very common, and very often this is because you've picked up a virus. Antibiotics have very little effect on Hajji cough. Unless you have an underlying condition like bronchitis or asthma, you should be able to get over the Hajji cough with plenty of fluids, but this may take 6 to 8 weeks, so be aware that some of you may even have the cough when you get back home and for a number of weeks when you're at home, but inshallah for most of you this cough will disappear. A sore throat will develop if you've not been drinking enough or if you've been drinking plenty of cold fluids. To try and drink where you can warm room temperature fluids, and try and avoid areas where there are bins where there may be many insects and you may sustain an insect bite. Should you get a bite and it's itchy, have a word with one of us or the pharmacy and see if you can get any antihistamine to reduce the itching. Dehydration I've already mentioned, drink plenty of fluids, and should you develop diarrhea, then plenty of fluids to wash your system through. Avoid eating food off the street as far as possible, but most of the restaurants and takeaways within the shopping complexes should be safe to eat. Some of you may have long-term conditions listed here. There may be others. Before you embark on your pilgrimage, have a word with your GP or your nurse. Get worse during your pilgrimage. especially things like mental health, where stress and fatigue is a common problem during Hajj, you may find that your mental health gets worse. Have a word with your GP. What can you do to ensure that this doesn't get worse? Do you need to up the medication, or do you need to do something different? For those of you that have physical problems, ensure that you are aware of what to do should your condition get worse. For diabetics who don't eat regularly, what do you do about your medication? For people who have asthma and bronchitis in the heat, where it's dry heat and there's plenty of people, what do you do if you should develop wheezing or coughing? This is your condition. You should be aware of how to manage your condition. But should you have problems, as mentioned, inshallah we will be around for advice and guidance, and where possible to help in your treatment. The pharmacies in Saudi Arabia will provide medication including antibiotics, but unlike the system, the NHS in this country, don't expect to have a full examination prior to a diagnosis and treatment. The treatment is carried out by the pharmacist, and very often this will be based on the history you provide. Should you be unclear about what medication you may require, contact the delegation, and inshallah one of the doctors will guide you on what you should purchase should you require treatment. Look at the list of medications and treatments in the manual, and this will give you an idea of what you can take in your first aid bag to help us manage your condition. As mentioned earlier, there is a free manual that we have produced, and this is to provide you guidance, but also for you to put in your own health problems to help you in future years on how you should manage yourself to sustain a good mental and physical health. The manual is free and can be easily downloaded from our website. Once you've downloaded it, each tip is only 2 or 3 sentences long, but they start from before embarking on your Hajj journey to what you should do when you come back. If you want to follow us, then we are on Facebook. Inshallah, this is not the only time we will be making contact. We will work with other people like tour operators, the City of London Police, the fraud organisations who investigate Hajj fraud, and where possible we will get information, video clips and various other material and post it on our Facebook page. So if you really want to stay in touch with how to enjoy Hajj and sustain good physical and mental health, as well as ensuring that you don't get scammed by any other agencies, then register on our British Hajj Delegation Facebook page, and inshallah I and my other doctor colleagues will remain in regular contact to support you throughout your journey. Jazakallah, I hope you found this useful. Have a look at these pages to give you some insight into what the manual looks like. Stay in contact and enjoy a good, healthy, physical and mental Hajj. And remember, if you need help, inshallah we'll be there. Free service, free treatment. All we want is your du'as for us so that we can carry on delivering this service to you. Okay. Assalamu alaikum wa rahmatullahi wa barakatuh.